Thank you, Bob. I'm going to go over to Antonia because she's got a hand raised.
Yeah, perfect. I was just going to talk on two notes what you were saying. Number one, that is key why as the nursing union or all unions just failing to look at broader issues, just focusing on pay. The RCN may not be leading this, but NHS workers say no, need to ensure that we are spreading the news in regards to how we need to fight for our NHS. And they do a lot of work with Just Treatment and other grassroots organisations, but we need to make sure that we are spreading the news in regards to what exactly is going on. And just from my point of view, from where I work in a sexual health clinic, which is currently out for tender at the moment. But what has happened recently is that we've taken on a new system, which we didn't have any say in the matter. Now, normally in a sexual health clinic, you will have health advisors who will do contact tracing. When someone has a positive test for chlamydia or gonorrhea, you will get the information, you'll speak face to face or phone them up. And in that way, we have had some really, really good outcomes. However, now, as part of our going out for tender, we have just bought a computer system which does it, which we can't access the details ourselves, and we just have to pass it on to the partner notification. And that just shows how across the board, we are working in silo. And I think that is what the grassroots of NHS workers say, no, that we are piecing the puzzle together as clinicians, just seeing how far the privatisation has happened, because they're keeping it deliberately ignorant, so we can't fight. So I think that it's really, really important that we have moments like this where we can across the board hear what's happening, but more importantly we have to support the grassroots organisations, because as I said earlier, we have got this anti-strike legislation and we are going to have our hands tied in order to fight for what we need in order to survive as a working workforce. So I think that it's really important that we are aware of that. And just to say another thing about virtual wards, I work, as well as a sexual health, I work as a hospice nurse at the weekends. And, I answer the phone calls from relatives where patients are needing the medication in order to ameliorate their symptoms. And I call the crisis team and there is no one, so we're seeing, talk about patient choice, we're having people because there are no beds in the hospice, we've got desperate relatives calling up, but there aren't the nurses to do that. And, if we're failing, you've only got one chance to make a death okay. And we're failing, in the worst kind of way. So it's all encompassing. And it's really important that we're gathering this information to spread across to people who might not be aware of exactly what's going on.
Thank you, Antonia.